You are listening to American Medicine Today, brought to you by the Bonati Spine Institute. I'm Kimberly Brummel, joined by world-renowned orthopedic surgeon Dr. Alfred Bonati, Jeff Wagstaff, and Ethan Euchre. Now, we have on the phone from New York City, and forgive me if I pronounce this wrong, but I think it's otolaryngologist Dr. Jamie Koufman, and she's author of the Chronic Cough Enigma. So, with that being said, how many people suffer from asthma?
Well, this book was written in part because I felt as though the medical mainstream hadn't quite got it right. Mm-hmm. We have now an epidemic of unprecedented proportions for reflux. Silent reflux affects almost half of Americans. Mm-hmm. And almost 1 in 10 people has asthma. Mm-hmm. Asthma affects now 20% of young people that are poor and non-white. So these epidemics have all occurred in the last 40 years. We've found that most people who have asthma, or at least a diagnosis of asthma, mm-hmm. actually don't have asthma at all, but it's silent reflux. And there are distinguishing characteristics, and these characteristics are not well known. And that's why I wrote this book.
So, Dr. Koufman, that's we actually, and Jeff will know who I'm referring to, but we have someone who works in the building here who is constantly coughing, and she's been to, all kinds of different people. She's even tried hypnosis and, crazy things like that because nobody knows why she continues to cough like this. So you're saying there's a chance it could be silent reflux? What exactly is that?
Well, the answer is reflux means backflow. That's literally backflow, and it's gastric backflow or backflow from the stomach. And it comes up into the esophagus, which is a swallowing tube. And everybody's aware of heartburn and indigestion. Most people think heartburn is reflux and reflux is heartburn. But it turns out it's not the case. People with reflux up into the throat, we call that airway reflux, goes into the sinuses, the nose, the voice box, even into the lungs. Chronic throat clearing, postnasal drip, too much throat mucus, a sensation of a lump in the throat, difficulty swallowing, mm-hmm. trouble breathing, and then, of course, cough, and that blustery throat clearing kind of cough in particular. And you can differentiate it. People who have reflux tend to cough after meals most. They cough when they lie down at night. Some cough when they bend over, and so on. There are characteristics that allow us to sort them.
Mm-hmm. Dr. Koufman, when you have this cough, and the material that you eliminate usually is clear on fluid, but when it is with a mucosity that is yellowish or contaminated, look like an infection, what's the difference between that?
The most common cause of silent reflux is reflux that occurs at night. Americans work longer hours. Maybe they go exercise at the gym afterwards. They get home and they're tired and they're hungry. They eat often the big meal of the day and then go lie down and then maybe get up later and have some dessert and then lie down again and reflux all night. People who have a productive cough, all you have to do is have them cough one time and you hear that chest tracheal rattle. It's diagnostic of chronic bronchitis. And by the way, reflux is the most common cause of COPD and chronic bronchitis as well. So as long as there's a productive cough of any kind, the underlying presumption is bronchitis or even a COPD. When the cough is without any kind, it's a dry cough without any kind of productive output, then that type of cough is often something we call neurogenic, which is more complicated. But the vagus nerve is a very common nerve that gets infected with viruses and then can misbehave, and it can lead to a chronic cough, independent of whether someone has silent reflux or not.
And so if someone has this silent reflux, can't they just take, an antacid or something like that? How does it progress to such a level where just over-the-counter medication doesn't work?
Well, first of all, not only does over-the-counter medication not work, prescription medicine doesn't work either. The most interesting and important article this year in the medical literature that applies to my patients is an article on Barrett's patients. A Danish study looked at 10,000 people who had bad reflux, and the conclusion of the study was that proton pump inhibitors, if you will, purple pills, you all know what they are,
Correct.
are associated with an increased, not a decreased risk of development of cancer, esophageal cancer. We know now that reflux, whether people are comfortable or happy about it, is related more to diet and lifestyle than to any other feature or factor in any other treatment that does not involve some change in diet and lifestyle behavior is not going to work.
So is that the treatment for this condition then, is exercise and diet more so than medication?
Well, it's not just diet; it's lifestyle. For example, if you get home at 10 o'clock at night, have dinner, and then go to bed, there is no medical treatment for that. You will have reflux. Mm-hmm. If you're a foodie and every Saturday night you're pushing back from a dining room table at between 11 o'clock and midnight, having consumed 2 bottles of wine, you have reflux. And so there are real, discussions to be had. I mean, it gets bigger than this. So 70% of America's calories are, food that has chemicals in it, pre-prepared foods, big relationship between reflux and soft drinks that are highly acidified. But yeah, what I recommend is a 2-week detox. Mm-hmm. It's not easy. No eating and drinking within 4 hours of bed, nothing acidic, nothing out of a bottle or a can, except water and no alcohol.
Oh,
and
you lost me there.
No Diet Dr. Pepper?
No Diet Dr. Pepper. I'm really sorry about that.
I do have a question for you, though. There's a note here, and it says if you have more trouble breathing in or out, that can mean different things. So why don't you sum that up quickly for us?
Well,
Dr.
thank you. It's the most important point. Mm-hmm. Asthma is always difficulty getting air out. It's exhalation, prolonged expiration or exhalation. If you have trouble with breathing problems and you can't get air in, during inspiration, it's reflux, not asthma. Getting air in as a problem is never asthma.
Okay.
Huge for people to know that.
So in is reflux, out is asthma.
Correct.
Okay.
All right, and I'm sure it's all covered in the book, The Chronic Cough Enigma. Dr. Jamie Koufman. What is Dr. Jamie Koufman? I have trouble with that word.
I'm a laryngologist. I started out taking care of singers and actors and rebuilding vocal cords. Since that time, we've discovered reflux is the most common cause of hoarseness, and so there it goes.
Interesting. All right. Well, once again, Dr. Jamie Koufman, pick up the book, The Chronic Cough Enigma. Appreciate you joining us on American Medicine Today.
Thank you.
Thank you.
Thank you.
And coming up next, we're going to speak with Greg O'Brien, award-winning investigative journalist who was apparently diagnosed with early onset of Alzheimer's. He'll be coming up after the break.
Scary.
Currently, you're listening to American Medicine Today on News Radio 970, WFLA. Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.
This is the first time that I am pain-free after 18 years, and it's just wonderful. I love it.
Phenomenal results, no pain whatsoever.
My pain is virtually gone, nothing short of a miracle.
Those surgeries gave me my life back.
Already I feel like a new person.
I'm going home new. I can chase my grandbaby now, I can garden, I can cook, and I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact I told the surgeon when he relieved the pain off the nerve.
The pain is gone, I'm feeling wonderful,
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.